Good afternoon, class.
Good
Good
afternoon,
afternoon,
sir.
sir. Good afternoon, sir.
I hope the day is good and then everything is fine. You are ready for the class, right?
Yes, please.
Yes, sir.
Okay. So before we proceed, were there issues from the last time we met? Do you have questions pertaining to our earlier on discussions about leadership when we had the introduction and then we did diverse styles of leadership? Maybe in your private discussion and then the group discussion, I asked you to look at the pros and cons of leadership. Did anybody come across something that you want to share with us? And then, so, I mean, once you are quiet, mean there are no issues. Is that the notion?
Yes, sir.
Okay. So this let's look at leadership communication in leadership. So that we'll look critically at some few constructs
Yes, sir.
and the leadership that has to do with communication. Okay, so today I want to look at communication and interpersonal skills. How do we communicate among ourselves and then among the clients that we deal with, and then among the various stakeholders we have? And what are some of the qualities that we are supposed to exhibit as far as effective communication is concerned? So before I go into today's discussion, I just want someone to tell me what he or she understand by communication. Because last week I was asked that you all read about communication for us to have a better discussion today. So can someone tell me what communication is based on your reading and your studies?
Sir,
All right,
please.
Naomi.
Communication is the art of exchanging information or ideas between a group of people or an individual. And I also read that before you get effective communication, it should involve with the sender, the message, the channel, the receiver, and the feedback so that you can be able to get effective communication. Thank you.
Thank you. So he has enlightened us about some few dynamics of communication. She didn't just tell us what communication is, but added the construct or the components of the channels of communication, whereby I said there must be a sender, a receiver, and a message. All right, Loretta.
It's a verbal and non-verbal interaction between two people.
So it is the verbal or non-verbal interaction we do within two people. It is the verbal, non-verbal interaction between two people.
And we
Charlotte.
okay. Okay, so some qualities of a communicator is that the person must make sure that whatever message is sending makes sense, is clear, and also does not affect the person in a different way. Thank you.
Come again. Your background is not so clear. Charlotte.
Yes, sir. Okay, so Peter, I was saying that as a communicator, you have to make sure that whatever message you are sending out there is clear and it is also not abusive of to the receiver.
Exactly. It is clear and mustn't be abusive. So you must be respectful of the receiver. Exactly. Yes, Mary, you can go on. If you are.
Sir, please, I would say it is how ideas are shared and
Yes.
expressed to each other, and it involves active listening and asking of questions, and also it must be clearly expressed.
Okay, so it is an active participatory activity whereby there's requirement of active listening and then active action. Hello, the last person. Sister Florence, can I hear you?
Okay, sir. From what I also understand, for communication to be effective, so as to reduce error, so as to build trust, so as to improve safety of the environment you find yourself in, that is the team that you are supposed to work. You have to make sure that at least you have these good listening skills. You must show empathy and respect, and then you should also ensure confidentiality. And whenever you are communicating, your ideas should be clear enough for people to understand you. And you must also respect the opinions of other people too. Thank you.
Okay, all right. Thank you all.
Salama tomorrow. Salama tomorrow. Why?
Okay, so because I just decided to take a break to rectify abnormality, we have turned the class into a market. Salama tomorrow, you are not even properly identified yourself, and you are distracting our peace. All right, so as I said the last time, we had ground rules, and those ground rules still applies to us. Without hesitation, when I take you off because you have iPhone something as a label, and then blah blah blah, not properly identifying yourself, please do not blame me because I have taken you off. If I see an unidentifiable person in my class, when you make noise and cause a distraction, I'll just put you outside. Okay? Yes. Okay, so let's continue with our today's lecture. So today we want to look at effective communication as healthcare professionals. Then we want to look at teamwork and collaboration. Then we want to look at how communication should go on between caregivers. Then we want to look at some report writings and some expectations from us in terms of report writing as healthcare professionals. Then we will look at documentation in brief, and then we'll call it a day. Handing over, I have not was ethically, and then professional is an evolving and increasing phenomena within the healthcare arena, because it is a field that is requiring each of every one of us within that sector to be able to interact within ourselves because of the multidisciplinary nature of our work. So you are working as a disease control, you are working as a midwife, you are working as a theater nurse, you are working as this. We should be able to have a means and a methodology of interacting within ourselves. And that methodology of interacting brings us to health communication. So we say health communication nonetheless, when they are analyzed from their diversity in meaning, we always point to the role that health communication can play in influencing, supporting, and empowering individuals, communities, healthcare professionals, and policymakers, special groups to adapt and sustain a behavior or a social, organizational, or policy change that will ultimately improve individual, community, and public health outcomes. These are what the health communication seeks to do. Now, I took the pain to earlier on ask us what communication was. And I think from our own elaboration and discussion, we have realized that it is the principles that govern. So it is the impact on the interchange of thoughts, opinions, or information by speech, writing, or signs. So we say that our understanding of these principles or this common definition of communication is going to be the direct translation of it into the health communication. And then we say that evidence have shown that more often than not, about 93% of us communicate through body language, attitude, and even using depending on the kind of tones we use, it's also sent as signal, while the remaining 7% is done by writing or by words. So you bear with me that those of us who grew up being stubborn, for those who were not stubborn, kudos to you, But those who were stubborn like me, sometimes when you do something, the way your mother will look at you alone will tell you the degree and magnitude of what she will do to you if he catch you in that act. You understand? The way the eyeballs will position themselves strategically. That kind of language, is very clear. You don't need an interpreter to understand that. Your mother is telling you that if I catch you, heaven will not save you. But even beyond that domestic activity, you will realize that in the healthcare profession, sometimes our attitude and body demeanor send a lot of signals, about 93% of signals than we speak. So sometimes before you even approach a client, your body demeanor, your facial expression alone tell the client the kind of person you are, and then the kind of services you are ready to offer. Whether you are ready to offer him services that will benefit him, or you are just doing anything to close your shift. So that is the difference between the professionals and then an ordinary person who may not be bothered about what kind of language he sends to his clients. So you see, in as much as you are just saying that I didn't say anything, I didn't tell the client anything, I didn't open my mouth, you didn't open your mouth, but your body spoke, your attitude spoke, your posture and your balance spoke for you. So in healthcare, we are saying that because of this sensitive nature of our communication, we have to make sure that every form of communication is safe. How you communicate with your client should be safe. Imagine you are attending to a client who has liver cirrhosis. We all know that the prognosis of such a condition is not good. But you see, you don't have to demonstrate it point blank that you don't have to demonstrate in the same way that the client caregiver will notice that you are indirectly telling them that they should contact the mortuary man for a folder of which your client will be admitted to the mortuary. You don't. But sometimes some of us, the way we behave, clients lose hope because of our attitude and then our behavior and body postures. Therefore, our communications become unsafe. You have a client that is sitting among a lot of people. You just go to the client, hey, mommy, your labs are in and you are HIV positive. How safe have you made that client among those people that he's sitting with? You realize that the care for that person is likely to reduce because people will begin to stigmatize against this client. So in healthcare, communication must ensure safety. It must ensure the quality of the care you are providing. You mustn't be the type that when you communicate through body demeanor, your client already loses hope in your care. Then you must be patient-centered. You must pay attention to the patient needs at that critical moment so that you do not elude the care you are providing. And I think one of us already told us what constitutes what communication, and that there must be a sender, there must be a message, there must be a channel, there must be a receiver, and there must be feedback. In this class, as we are having now, the sender of whatever information we are doing now is me. And the message is that I'm teaching communication currently. That's my message. I'm trying to let you understand the principles and the concepts of communication. And the channel I'm using to teach this is digital system. I'm doing audio at visuals. The receiver is you, my faithful students. And the feedback I will get will be either in mid-semester or end of semester, where you justify what you have learned from every 2 hours of us interacting under leadership and what and management. So in this case, there should be a sender. Somebody must be giving out an information, and that information should be a message. Receive, but whether he has received your message in good faith or not. you must also understand that behind these principles of sender message, channel, receiver feedback, there is something we call decoding of the message. Your client should be able to decode whatever message you are sending across to him. So if he's not able to, because he doesn't understand. And a clear example is, you tell a woman who is just sitting there, who doesn't, that woman does not even understand in the first place, come not to talk of palpate. So the woman will just sit there and look and be staring like you as if you just returned from Jerusalem. But in reality, it's not because he wants to stare at you, but it's because this woman has not been able to decode your message that you are asking her to come for you to examine her pregnancy. So decoding the message is as important as sending the message. Now, communication can take 4 divergent points. It's either it is a verbal communication, which most of us think it is the only method of communication whereby we speak and that is it. No. Spoken words are always the least of form of communication. There are a lot of us, before we speak, we have thought and we have acted and demonstrated, and yet it didn't change, so we decided to speak. Now, let me talk about the non-verbal communication, which has to do with our body languages, facial expressions, eye contacts, demeanor, postures, and balances. Within the healthcare system, you see, we hardly speak to all of our clients because we have a lot of clients to deal with. But sometimes a client is lying somewhere, you say, oh, please, my patient is there. You tell you the way you, a manner at which you will stare at the caregiver and stare back at the patient alone already tells the caregiver that I am not ready for your nonsense. You hear me? I am not ready. You and your patient lie there in peace. Let me be sitting on my table in peace. You get it? That demeanor alone is a wrong signal you have sent. Now, if I'm the one you do that to me, and eventually you come back trying to attend to me, what do you think will happen? Do you think I will smile back at you even at that point that I need your care? I wouldn't. And that is the danger lines that comes in. Now, the most common one we know, which is written communication. I mean, within the health sector, we talk about reports writing. We talk about charts and graphs for the representation of our reports and findings. We talk about records keeping. We talk about administrative record keeping. Okay, documentation in the word, nesting notes. These are written communication we put down that in our absence, those who take over from us will understand whatever that transpires in the word in their absence. Then the last one is the electronic media of communication, which is either through an email or through what we call the electronic management system. So it's either you are doing an electronic communication or you are doing a written communication. So depending on the type of system you run, type of communication. So if you are dealing with a client of which you know that there is supposed to be a media of communication and you are not arriving, you have the luxury of choosing a diversity of what communication medias. Now, let's look at some key characteristics of health communication. We said that health communication must be evidence-based. In the health sector, whatever we deal with has to be evidence because we cannot create fear and panic and be expecting to be forgiven. So you must have a solid evidence of whatever you are going to communicate about to your client. And besides that, you must have a multidisciplinary approach to your communication. This is because when we look at the environment surrounding communication, you will realize that we have a diversity of environment. And with that diversity, you will definitely also require diversity in strategies in meeting the various environments that you are dealing with. Now, I gave an example that a man was on his sick bed, and this man that was on his sick bed was very active, interacting with his family, laughing and joking. Then this nurse came and said, "Oh, Papa, your lab results are in, but unfortunately, you are HIV positive." This man said, HIV positive. They said yes. Then this man that was laughing and smiling with his family, all of a sudden became very malice, unconsciously unactive, looking weak, was talking about ancestors welcoming him, and so forth and so on. Then all of a sudden, the nurse realizing that the results was not supposed to be for that man. So he went back and said, "Sorry, I gave you the wrong results. Please, you are not HIV positive. It is the other person." And can you imagine what happened? The man that was on the sick bed and couldn't talk and couldn't walk had some extra energy to walk to the washroom, to ease himself. That was a relief. Meaning the man was not dying because of his condition. He was dying because of the wrong diagnosis of information we gave him. So you see, if you do not have the correct evidence about something, you do not speak about it. Because when you speak about it, as a professional, people believe in what you are saying and therefore stand to act according to what you say. You must be strategic. You must know when to give a communication. It is not always in every place you can just stand and open your mouth to the 360 you want to open and just communicate to anybody at all. Imagine somebody is standing at his one corner trying to secure some points from a young lady he has been trying to talk to for years. Finally, he has gotten the attention of the lady. Then you that you are working in that laboratory, you just run some laps from the guy and realize that he has a urinary tract infection. Then you are going and you've seen him standing with this lady. You say, "Hey, hi, young man, I've been looking for you. I couldn't find your contact. I was trying to tell you that you have to come to the lab and we'll retest you because it looked like you had a urinary tract infection when we ran." My sister or my brother, what do you think you are doing? Is that the strategy? Are you strategic in your communication? Are you being fair to this young man? You see, you are not just being strategic. So, you are communicating something that will improve the health and then the well-being of this young man. It's nothing unfundamental about it. That is fact. He needs to know his status to get cured. But you see, at that point, that young man can kill you, even though you're after his good. Because you have spoiled something he has been targeting and aiming for decades of his life. The opportunity has just arrived. And you have come from nowhere to incarnate yourself to be his savior. Can you just imagine? So your communication must be strategic. You must know when to communicate to your clients in the world. You don't go to a client to tell him his medical status when there are patients, visitors all around and surrounding him. No, you can't do that. The processes must be well oriented. You must have a laid out process of communication. You see, then they must be cost effective. You can't travel all the way from somewhere in Bunkurubu Yoyo to go to Tamale to tell somebody an information and go back. No, when there are other mediums of communicating with the person. So those are some of the characteristics of health communication. You must be creative in support of your strategy. So you see, you had a strategy, but you see, I don't want you to have told a young man, "Oh, Chief, I've been looking for you, but you see, can you see me when you are done with this, your business? We need to talk. It's urgent. And it will be for your own good that you see me." At least you are creative at this moment. You have been able to elect the man the guy that you need him badly, but you have not also still spoiled his game of play. You see, then you must know it is audience and media specific. You must have an audience. You must have an audience before you speak. Then relationship building. It's all about relationship building. Then we talk about the behavioral and the social structures and the inclusions of the vulnerable key people in what? The healthcare. All right. So let's look at the environments that surrounds what? Communication. Communication, I have communication specific, I have about 4 major environments. And our ability to understand this environment at every point in time want to give out a communication or a message is very important. First of all, you need to know who your audience are. Understand the principles of your audience, their risk level, and then their health belief models, and their attitude and health-seeking behaviors, and their cultural and age dynamics that surround them. You must know your audience. You must know the literacy level of your audience so that it will inform the type of message you are going to give. If you go and your audience have not gone to school, and you go and you are talking about the metaphor and what you are speaking nonsense at that moment. And the audience may now the guy, the lady, whatever will just be looking at you as another mad person in a decent clothes. You understand? Get to know your audience. Understand the dynamics of them. You understand? It's very important. You see, sometimes you go and you talk and they say, my people are not cooperating. It's not that they are not cooperating. They are cooperating. But the problem is that you are the one not what communicating well. Because you don't understand them. You go and you are talking about HB. That matter, your HB is low, your FBC is this, your WBC is. What are those things to the audience? Because he has not gone to school. You see, he has not gone to school, so he doesn't understand it. So he will just look at you and say, this is another mad woman. What person you are going to give the communication to? Know the cultural background, understand the age and the gender-related factors surrounding the person. Know how the person perceives health in general before. What, for example, I always tell people that if I'm going to talk to bankers about hypertension, and I'm going to talk to someone who is a laborer or a mason about hypertension, it wouldn't be the same message I'm going to give them because they have different risk factors. They have different risk factors, they have different age, they have different work environment, they have different perspective. Their level of literacy is different. So the grammar I'll be speaking to the banker will be different from what I'll be speaking to the laborer. So you need to understand who your client is at the moment that you're going to give. Who the receiver of the messages, you have to know and understand the person better. Know the policies and the political environment that surround the message you are going to give. And I gave a very clear, beautiful example about HIV case. In fact, in the HIV world, where we live and dine and swim, we do not have rights as professionals over HIV positive patients in terms of disclosure. You and I, we are living and dining and swimming inside there when we know, because we know a lot of people's status, but you cannot say it because you are bound by the laws of them that says that what, unless self-disclosure, there is no third-party self-disclosure. So you know this guy that is working with this lady, that this lady is having HIV. But this guy too is married and he has kept the main farm in the house. But this garden that he's carrying is having HIV. You cannot go and tell that man that your garden has HIV, because if you do, and that woman get to know that you are the one who said it, he will sue you in the law court and he will win the case 100%. Or let's take it that this woman do have HIV. Then he says, oh, Mama nurse, Papa nurse, please, can you talk to my husband that I have HIV? But let him understand that it is not through the other way I got it. You as a professional, even though the woman has given you the right to do it, you do not have that right to do it. Because if you do it and the marriage annulled, and the woman says that you are the one who broke her marriage, she will be right and she will be having all the support in the world to sue you in court. And you cannot do anything but to what? To lose the case. So you must know the policies. But we also know that the policy is that if you have a partner and you are infected, you must disclose your status to your partner. So you can then tell them that, look, even though I don't have the right to tell your partner about your status, but I am telling you, if by 2 weeks your partner does not know of your status, I will also take legal actions against you. So you must know the policies and the dynamics surrounding the message you are carrying in your heart or in your mind, or the message you are about to decentralize. Because if a patient is lying on the bed and there is a caregiver to that patient, and you want to disclose his status to him, and you go and he say, oh, he's my caregiver, don't mind, you just say it and he also hear. Be guided. Be guided. You need to tell the person that, oh, based on our policies here, and because of your own confidentiality, I need to disclose this one to you and you alone for now. Now, health communication also has to do with the social environment. The social environment. Now, you have to understand that the social environment in which you find yourself influences the type of communication messages you give. Now, I was telling some other group that in some settings, you can use some vocal languages, like you can call any of the sexual organs by their names at free will and at free push that nobody give a damn about it. But in some culture, what because if you just mention those words just straightforward like that, hey, assembly problem will come. You see, you can't just go mention the female part like that, just mention the name, mention the male. Hey, if you mention, people think that you have dropped a bomb. You have to know the cultural practices of the person you're talking to. Her culture doesn't allow that message to be delivered in that manner. In some places, a man and a woman cannot be left in isolation to discuss. What are you discussing about? That you go and tell the man sitting with his wife who has come for ANC that I am the male doctor. Can you permit me to take your wife inside this room and we'll have a discussion for 15 minutes? What are you going to talk about for 15 minutes? Some cultures don't permit other men to touch their woman part. For example, if you make a mistake and touch the parts of another woman in terms of her breast in another culture, you marry that woman. The husband will leave her for you. You see, because those are some of the basic cultural dynamics that we need to understand. So you want to do so, mommy. The woman was complaining of breast lamb. They say, okay, can you just come and lie down and let me examine your breast? Then she just lie down. Then you wear your clothes, no gafra, no excuse, no ago. Then you just start pressing around. Hey, you married a woman, and the husband is there, or even the woman herself will tell the master, you have to marry because now you have pressed me, you have spoiled me. I can't go back to my husband's house. You were supposed to give me excuse or ago or gafra before you press me. Now you have finished pressing since my husband was supposed to be pressing. Master, you have to marry me. So you have to understand the common cultural dynamics before you miscommunicate. Now, the other thing is that you have to understand the health products and services that are available to your client. And a practical example is you go to a community and you see a lot of malnourished children there. Then you want to help them eradicate their malnutrition. They say, oh, you have to eat a lot of food, eat a lot of fruit and vegetables like spinach, fruits like apple, strawberry. Mommy, you yourself, you see strawberry before. Then you expect that this woman or child that is in the village should eat strawberry and eat apple. No, you have to be realistic about what is there. You have to let them also understand that the message you are giving them is for their good. And if they don't take actions, these are the dangers assigned to the message. Then you have to talk about the availability and the services that are there. What advice do you have for them? And the advice you give them for the services they need must be available and accessible to them. You tell the woman to eat strawberry. When you yourself have not seen strawberry. and then you want them to give this child strawberry. It won't work. It won't work. So as professionals, you must understand that every message. So sometimes that is what happens with our messages. You say, oh, but this woman, I've been counseling her. I've been talking to her, but she's not changing. It's not working. There is a problem with one component. There is a problem somewhere. So sometimes it's not about the communication. You communicate. You tell the person the message. You even do it very well. The person will sit down and look sober, look at you and say, hey, what you've said is all true. The person even is level just on 1% before the person to melt because of what you said. But when he leaves your place, no, shit, nothing changes. It's not because the person doesn't want you, but the environments are not supportive. What you have said maybe doesn't fit within their cultural dynamics. It doesn't fit within their political area. They don't have access to those resources. What are the principles of effective communication? For us to be effective in our communication with our clients or with ourselves, there must be clarity and simplicity in our communication. You have to be clear with what you are. There mustn't be ambiguity. Look, don't tell a woman that your FBC is no good. What is FBC to this woman? Your HB is low. What is HB to this woman? Your WBCs are high. What is WBC to this woman? Your glucose levels are high. What is glucose to this woman? Your proteins and ketones levels are not normal. What is normal to this woman? Be simple, be clear, and be straightforward. Madam, the blood in your body is reducing. That way he understand, and you see it to be a big problem. Then when you tell that his HB is less than 7, it's less than 7. What is HB to talk of less than 7? So that we need to be practicalizing our communication simple as much as possible, irrespective of the literacy level of the person. It must be clear, it must be simple, it must be accurate and complete. Don't leave the person suspended. Look, if the person is like me, whose ears are sweet, then if you tell me that, oh, I have something to tell you, until you tell me that you won't sleep, I will call you at 12 a.m. to tell me that thing. So me, I always tell people that if you know you want to tell me about somebody, don't tell me that I have something to tell you about this person, because you tell me about that person in the presence of the person. But I can't wait. And that is the reality. You don't leave people unattended to, standing in what? In delusion and unaware of what is happening next. You must be complete and accurate with your information. Your information must be timely. Your message must be timely. You don't wait for the event to happen and pass. Then say, oh, but I saw it. Oh, I wanted to talk to you about it. So you wanted to now see what you have caused. You have now caused the harm, or the client have caused the harm. You must be confidential. Hey, that one, some of us, our mouths. Hey, yeah. Hey, you see that lady that is staying behind your house, that has been running around with that Prado car. No, he's not the one who bought it. Oh. Hey, he came and removed 4 portions. But now all those 4 men, no, they impregnate and they easy concern you. It concern you. Whether he remove or he put, it concern you. Your only duty is to promote the confidentiality of that person, period. Whether he remove or he put, it no concern you. That pastor that has been making noise, that what his child has been to my unit severally for family planning. You will even put a family planning, should go and get pregnant and come and will remove the thing. It concern you. It don't concern your life. The person has come to you as a professional. That is what you're supposed to do. You're supposed to remove and put. So when you remove and put, it's period. Simple. You don't have to go and turn into Al Jazeera everywhere. Broadcasting. Oh, why you do that? You're not communicating. And that's what some of us are there. When people come to our facilities and they see us, they turn around and go away. And don't assume that your colleague sitting by you is going to be as confidential as you are in the presence of the client. No, you don't know whether your colleague sitting know the client or the client knows your colleague. So when it comes to some of these things, you have to be, please, can you excuse me and the client, period. Because in the presence of the two of you, the client sees the two of you as nuisance. But one person may be single, better. You must be an active listener. Hey, some of us listening there. Before the woman starts, no, you have concluded, you have judged her, and then you have started blasting her. I've been telling you, we've been telling people not to do this. When you give birth, come for family planning, you cannot see what to the woman. Maybe he has done a family planning and it failed. You listen. Sometimes in America, can you and I know that it is not all about what? Therapeutic medications, only to give what? Psychological therapies too. So your active listening and showing respect and empathy to the woman it's a healing process. It's part of your, and you condemn the woman and you give her medication. It will work. And for that reason, you are not communicating. So for you to be an effective, you have to stop if you are not doing this. You have to be very clear, be accurate and be timely, be confidential and be an active listener and or what can we do we use it to do? And those are what we are going to look at in a few minutes. We say it enables us to create an awareness of health issues and their root causes to drive policy and practice change. Just like we had in the COVID era, whereby we drove a lot and wearing nose masks to protect, decided to stay indoors to secure our lives because there were policies that restricted human movement, and that was communicated to people through the media of communication. So that is why health communication is useful, to raise awareness. It's not a methodology used to encourage, engage, and empower community. I'm empowering you people so that you can be empowered in terms of your communication with me, with your client, with your other stakeholders. So it's a method of empowerment. So I think the network is misbehaving here. I don't know what, for whatever reason, my MTM is misbehaving. Some of you didn't perform the needed rituals before joining the class. And because the MTN is punishing me. If not all of yesterday, I didn't have issues with network. Anyway, I hope you can hear me now and see the projections, right? Yes.
Yes,
So we're
please.
looking at what health communication can do. So we say that it can also promote and emerging issues to establish new standards for care, just as we had during the COVID era. We were able to collaborate and discuss among ourselves and other stakeholders and establish a new protocol which was able to enable us to go through the COVID period successfully. So that is what health communication can also do. Increase demand for health services. So we use that advocate to also increase the demand for the services that we provide while showing our resources or our products that are available, provoke public discussion, build constituencies to support health and social change, advocate for equal access to existing health products and services, and strengthening third-party relationship. So let's look at what are some of the barriers to effective health communication. What are some of the barriers to effective health communication? So at this moment, let me hear if we have some barriers. Let's do share. What are some of the barriers? Yes, Loretta.
So a language barrier.
I knew you would say language barrier because that has always been the most common barrier, but not in healthcare.
So language barrier because let's say you find yourself in a community where they speak Ewe and you are not an Ewe. You can't communicate effectively. Most of them don't understand the English and the Tree. So how will you translate your results to them?
So can we look at the types of communication? What you are talking about is verbal communication. What about sign language? What about sign language? What about demonstration, body gestures, act? Yes, it's a barrier, all right, but we are trying to overcome that barrier. And as part of this, we are looking at the barriers and we are looking at how we can overcome some of those barriers. Angela.
Sir, the disease condition.
Okay, can you explain?
When someone is seriously ill and you're communicating with the person cannot get you clear because of the way he or she is feeling.
Come again, I didn't hear that.
Please, I said the disease condition can affect the communication in such a way that when the person is seriously ill or the person is in pain, when you communicate to the person cannot get you well.
That's true. The state of condition of the person. Yes, Hannah. Hello, Hannah, your hand is up.
Yeah, sir. Please, the use of medical jargons.
The use of medical jargon.
It's also a barrier in communication.
That's a very strong barrier we have. Sometimes we presume our clients understand us so well that we start using our jargons. HBT, DM, sickle cell, XSC, he's AC, he is this. Those are serious barriers. Naomi.
Sir, please, poor attitude of health workers.
Come again.
I said poor attitude from the side of workers. Yes.
Attitude, very important. Attitude, our attitude is very important. It's a strong barrier. How we behave towards them will not allow a client to communicate back to you. So the feedback, you wouldn't get adequate feedback because of the way we go about our attitudinal behaviors. Yes. Florence.
Sir, I would say culture
Okay.
barriers in the sense that if I don't understand the culture of my clients, it will be very difficult for me to communicate to the client. So it is going to be sort of like I'm insensitive to the patient. But it's not because of that. It's because I really do not understand the culture of my clients so as to be able to communicate very well with him or her. Thank you.
That's true. That's true. So cultural dynamics, the cultural, the social cultural beliefs, practice, values plays a very critical role. Portia.
Yes, sir. Sir, please, lack of privacy at the consultation center.
Exactly. Lack of privacy. Sometimes you are 3, 4 in the consulting room and the patient has come in, you are laughing jiggly and he's looking confused. And then we are not even bothered about it. Oh, we don't even calm the patient. The patient coming, you are seeing that this patient looks so disturbed. Then you are like, oh, okay, please, what can I do for you? No, sometimes you need to calm the person. Hey, mother, you look so disturbed. What is it? Can you calm down, relax? Sit down. Should I give you water? Then before you now start asking what is the problem. Noise. Noise as a barrier. Just like some of us will do. We'll join late and create noise and distract the process. Cause barrier for us. Cause mess. You see, noise. Is very important. Who raised the noise? Beatrice, you did well. Noise. It's a very big barrier to communication because two people cannot be communicating and sending message at the same time. Someone have to keep quiet and listen, and then the other will finish. But when you are talking and then people are also talking and talking and talking, some are shouting, it will always be a barrier. So those are some of the barriers. Poor listening skills, okay? Work overload, exactly, man. The overload we have in our duty shift, the turnout and the burnout rates are a big barrier. That because of that, you are in a hurry, you are stressed, you are burnout. So sometimes you transfer your frustration to a client without even noticing your action. Is one thing. So these are some of the barriers that have been listed for us to also add to the ones we have listed. Personal values and expectation. People with their personal expectation don't drink beer and say, oh, after all these years I have worked, why shouldn't I enjoy and chill? Because he wants his personal expectations to be met, despite the fact that it has his health implications on him. So those are some of the challenges. Yes, Hannah, your hand is up.
Yeah, so with the barrier too, can we say cultural gaps can also be a barrier?
Cultural
Gaps, yes. Yes, I encountered one client who came to the facility. He removed his slippers and I was asking him why. He said he knows that the health facility is a clean place, so anytime he's going inside the facility, he has to remove his slippers because of where he's coming from.
And that one can also be impersonal differences. If you get it, personal differences or personal perceptions about things. That's very true. That's very true. Let's look at teamwork.
Yeah.
So, what is a team? What is a team? When we talk of a team, what is a team? Not I don't mean Manchester or So what is a team? I'm still waiting. So somebody said a group of people with different skills working together to achieve a common goal. A team is a group of people who come together to work in order to achieve a common goal. So in all, there's a common goal. There's a common goal. Yes, Auntie Joyce.
Yes, a team is a group of people who have different skills and work together on a common goal.
People with different skills. Different skills who are working towards the achievement of a common goal. All right. Anybody else? Yes, they have different skills, but they are working towards a common goal. Anybody with different opinion? I'm a team player. Yes, what is a team? I'm still waiting. Oh. Okay. So, if not, what is collaboration? Every now and then we hear about collaboration. This person has collaborated with this person to produce this, and they have collaborated to do this. What is collaboration? Should I mention the names as I have? Oh, we started with what is collaboration? A group of people coming together with the same ideas and supporting each other towards a goal. That is according to Sister Ifwam, that is collaboration. Hands. Okay, Sister Florence, you want to help us? Help us.
Oh, okay, so I'm trying. So what I understand about collaboration is that in collaboration is when a group of people meet together to discuss on an issue, find solutions, and then work together. So in collaboration, one person alone does not impose his or her ideas, but sort of the group of people will come together. That's how I understand the collaboration. Thank you.
Thank you. So people coming together to achieve something with a common interest at hand. Naomi, I thought I saw
Sir,
your
please.
hand.
Yes, sir. I thought my sister said, oh, that's why my hand went down. Please, the collaboration, that one, like group of people with different ideas coming together to achieve a common goal. Like they have different ideas altogether, or they have different work. Like the work they do, they are different, but when they come together, they achieve a common goal. Thank you.
Okay. So different ideas, different working together to achieve a common goal. That is beautiful. Collaboration in the health sector is defined or is categorized as healthcare professionals assuming complementary roles and cooperatively working together, sharing responsibility for problem solving, and then making decisions to formulate and carry out plans for patient care. So you see that all the indicators you mentioned comes into bearings here. So they come together. Complementary roles means that you have your different jobs, but you are complementing each other with the aim of cooperatively working towards what? Achieving a common goal. So you share responsibility. So there's a sharing of responsibility component. And then what do we need the tool in the health sector for? Is because when we collaborate as professionals, we get to understand our individual knowledges and skills levels. And this will lead to the continuity of what? Care provision. When I collaborate with Perita, Perita will never know whether I can deliver a mother of his child or not. But when I collaborate with her, she will get to know whether I can do it or not. And then he gets to know whether I have the skills or I just possess the knowledge. So when we do that, at the So at the end of the day, Perita is able to collaborate with me and get to know what I am capable of doing. Now, in the allied that he doesn't collaborate with me, he will never know what I can do. So in the profession, we collaborate with each other so that we will get to know each other's skills and strengths and what each person is capable of doing. And that is one important thing about collaboration in the healthcare sector. Now, when we talk about teamwork, we are saying that teamwork is one of the greatest proponents in the health sector. And its effective characteristics are what? Trust, respect, and collaboration. Because for you to be able to form a solid team to work with, you must have trust for each other, respect for each other, and be able to collaborate among yourselves. Then we say that it is the endemic to a system in which all employees are working for the good of a goal, who have a common aim, and who work toward together to achieve that aim. Now, when considering a teamwork model in healthcare, we rather go for the interdisciplinary approach rather than the multidisciplinary approach. Interdisciplinary means that you all leave your skills and your main job description and come on board to work to achieve that particular goal. Multidisciplinary approach means that you all work unilaterally in your main professional zone. So the anesthetist will work as his anesthetic, the theater nurse does the same, health promotion does. But in the case you form a team, you all put these job descriptions aside and rather leverage your knowledges and your skills together to achieve the common goal at hand. Then an interdisciplinary approach coalesces a joint effort on behalf of the patient with a common goal of discipline involving in the care of that patient. Now let's look at what are the components of a successful teamwork. Just as we have successful communication, but this one goes beyond just communication, but other components. So there must be open communication. You must be open to each other in your discourse about the patient or about the job or the task at hand. There must be non-punitive in your environmental and attitude. Clear directions, clear and known roles and tasks for team members. Everybody must know the role to play. You mustn't say that I am the team leader, so I am just going to sit down and give instructions. No. As a team leader, you are entitled to participate in the activity and be a shareholder in the activities of the team. Not to just sit and give instructions and directives or sit and put your legs on the table and be punching your phone. Respectful atmosphere. You must respect each other at that level. There must be a sharing of responsibility among all team members with support for each person to achieve that activity. So we said there must be appropriate balance of member participation for the task at hand. So you mustn't say you are part of the team and yet you are sitting in isolation expecting the donkeys to do the work. The moment you say that you are the horse, you will not do, the donkey should do all the work, then you are not part of the team. You are no more a team player. Because a team player participates in the team and take part in the tasks at hand. There must be accountability and clear guidance to who leads what, decision making, routine communication, and then there must be access to needed resources and then the mechanism to evaluate the outcome at the end of the day. When we do good collaboration as a team, When we decide to all become the donkeys and do the work properly, what do we achieve? Access and coordination of health services. We make the participants have access. Okay, the client get access to a well-coordinated healthcare services at the facility level. There is appropriate use of resources and logistics because you are at a task, so there's no wastage. There's no try and error here. People bring their leverage knowledge for you to solve the problem. Health outcomes for people with chronic diseases get improved because there is a solace of what knowledge and skills and expertise that are geared towards what that client. There's patient safety, which will result in the satisfaction of the patient or the caregiver. Then the time wasted will reduce, which will end up at the end of the day promoting what? Acceptance to what? So these are just the same thing as I've listed, effective team communication strategies, just the same thing as what? Effective communication strategies. Let's look at midwifery and teamwork. As midwives, what are we supposed to be concerned about? How does our functioning team affect quality care? Your team you have in your maternity unit, the team you have in your CHIPS compound, the team you have in your health center, how does it contribute to health quality of care? We said the midwifery profession depends on a team to carry out its mission and objective. It is not an isolation unit that you say that what I am a midwife, but I'm not ready to collaborate or work with anybody. Then you are not ready for midwifery because it's a teamwork ground. Somebody will have to help somebody catch the baby, and somebody has the dressing, the cleaning, the documentation, the recording, and everything. It's a teamwork. Another person has to do introduction of complementary feeding, exclusive breastfeeding, and so forth. So you mustn't say that you are coming to midwifery to practice and still be a boss person. You have to be a team player. We say midwife stays on job where teamwork is effective. Because once I am with these people working and we are all working together, I am coming to shift and I know that I'm not coming to do a burnout duty. At the end of the day, I will work with people who will also motivate me to work. And we'll all work happily and finish happily and go home with no one being stressed out while the other being relaxed. Teamwork is generally recognized as essential for patient safety. You have to do CS for a woman. You, the midwife, will prepare the woman for the theater. Go and hand it over to the theater staff. They will go and the anesthetist will do his part. The doctor will do his part. They will suture. The theater people will bring you back your baby and mother. The NICU people will do their part if there's a need. So it's a teamwork. It's not just about isolation, working alone, and I'm alone. People don't want to know. It's a teamwork. So we say that of the midwifery profession, it is inseparable from midwifery work and necessary for safety of patient care. That is teamwork. So teamwork is inseparable from midwifery profession. And we do not work in isolation. As midwife, we can't work in isolation. So why is it important for us to communicate with our patients? So that we can build their trust and confidence in the healthcare system and in us as healthcare providers and in the treatment plan we are giving them. Through that communication, you tell them vividly what you are doing to them and what the expected outcome of your actions are as far as their health condition and recovery is concerned. So you build their trust in you, and they are having the confidence to disclose sensitive issues that will influence their health, which you will also need for decision making. You reduce anxiety and fear by your ability to calm them and let them trust you that you are heading towards something. Not that you speak and your body demeanor shows that it is time to get a folder from the mortuary man. No, you mustn't show that fear and anxiety in your client. Even though you know that the client is time to get admission into the mortuary, but you don't tell the relatives in your body demeanor that people get ready that you get a folder from the mortuary man. No, you have to reduce the fear and the anxiety so that even the patient will go in peace if he has to die, not dying with anxiety and fear. You have to promote patient participation in care through communication. So when you do communication well, the patient will participate in their own care. And you know that as far as the recovery process is concerned, the participation of the patient is important. And you must improve adherence if you don't communicate. Now let's look at the principle. So it's the same principle. You must respect the dignity and the privacy of the patient. You must use simple and understandable language, not ambiguous language. You must be listening actively to the patient, show empathy and compassion, and encourage questions. Most of the time in the consulting room, we don't listen. We are so in a hurry that the patient says, I have headache, I have malaria, then you say go for medication. I have running nose, I have running stomach, go for medication. We do not interact with these patients to even understand why these things are happening to them and how they can prevent them in the future. So how do we communicate? So you communicate by supporting participation of patients and families as integral partners in the healthcare system. You share information in a respectful manner, a way that is understandable and encourages and enhances participation in decision making between you, the healthcare provider, and the patient and the caregiver. You also facilitate communication by what? Ensuring appropriate education and support is provided. Then you have to listen respectfully to the client. Let's look at report writing as the last component, wrap it up with further questions and discussion. Now, when we talk of report writing in the health sector, we said that work with our reports or documentation is tantamount to nowhere. You can deliver to nothing. And that's why we have the World Guinness Book of Record to document significant things that has happened in the world of today. But so we say reporting is a document, or a report is a document. When you say report, it's a document or a means of communication which so somebody generate the reader. And so your report content must suit the reader. The message must be able to be decoded by the reader. So then the report gives what? Situation or problem analysis of things. It may state facts, give analysis, progress, conclusions or recommendations about situations or activities being executed at your level of work. And we said that within the healthcare sector, it is the activities that we do in documenting information and findings within the midwifery arena in our ward and as administrators of midwifery activities. So it provides accurate and concise and clear methods of communicating our information for decision makings and policy drivens. And then at the end of the day, we are anticipating that when these are done very well, there will be quality in care we provide. So what are the types of reports that we write in midwifery arena? We have basically 3 types of reports that we write. We have the clinical report, we have the administrative report, then we have the research report. Now, when we look at the clinical report basically also entails 3 different components of report. The first one has to do with the patient care report. And the patient care reports are reports that are pertinent to the patient and remain with the patient and remain between the patient and the caregiver, the clinician at that point in time. So, for example, at the antenatal clinic, this midwife who is palpating this woman, the documentation you do in the maternal and child record book is the patient care report. It is only visible to you, the provider, and the patient. If I don't pick that folder, I will never know. If you don't go and do concern about that folder content, then other person will never know. So it remains solely with the patient. So sensitive ones are antenatal, delivery. When you plot your photograph, if you don't send the photograph to your municipal health director, and then your other colleague who is in Ghana will not even know that this is how the photograph of this man look like until you do concern by giving it out. So what it means that these are reports that are pertinent to only what? The patient care and the care problem. The incident report that are maternal and neonatal complication report, maternal audit report, death audit report. Those reports are not secretive reports. They are reports established in domains that everybody can have access to them for best practices purposes. Then perinatal reports, such as cases of miscarriage, stillbirth, and neonatal deaths. So these are the 3 components of what? Clinical report. Now let's look at administratively. What are some of the reports we write as midwife in terms of administration? We have the shift handing over report, which entails our nursing knows incidents notes, prescription, admission, A&Gs. Those are what we call the shift handing over report. Then we have the staff performance and annual appraisal report, which we fill our annual performances, and a report is generated by the unit head, submitted to the departmental head, and from departmental head to the region and so forth, which influences your promotional hierarchy or career pathway. And now we have the national strategy that has come in, and we are now doing appraisals using electronic media. The inventory and supply. So as ward, you are supposed to have an administrative inventory of your ward things, what happens in your ward, the medication you are giving, the drugs you are giving, and those other things that you are giving within your ward. Then budget and finances, the little coins that come through your unit for whatever purpose, you are supposed to have a documentation of it. I will receive thousands for administration. This is what I use it for. This is what is left. This was consumed, and blah, 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 blah. You must have a report for it, so that when you hand over, you are proceeding on leave and you hand over. In your absence, when they ask, the person can refer to them and report. Not to be calling you, hey, come, they're asking about this money you collected. Come and explain. No, you have to report and write it down. Then we talk about research-based practices, best practices, quality improvement, and perinatal death audit. So I've spoken about these ones already, and they are very critical in our sector. Now, when we talk of monthly reports by midwives, I mean, we know them. Those of us who have programs like the IMOC program, we write reports. Newborn care, we write report. Form A, which we write and enter into DIMS, bed occupancy, those things. We cover our delivery rate, number of women we delivered, how many children were delivered, how many were twins, what were their sex, what were their status of life, were they live birth, were they stillbirth, were they macerated, how many were low babe, what was the HB of the woman, how many were home delivered, how many were premature. These are things that are in the monthly report form of Form A. Those of us who don't know Form A, it's only those of us who don't write reports that will say that we don't know Form A. But once you are practicing in the healthcare system, and those who have not yet started practicing as what midwives but have joined us, you may not know how the Form A look like. But this is how the components of the Form A definitely look like. So the antenatal services provided, postnatal services, you indicate the figures and things. The family planning services that you provided, the adolescent healthcare services, and then the RCH. So some of this go into the RCH reporting format, while some goes into the maternity reporting format. Now, beyond the Ghana Health Service reporting, whereby they ask you to either put a 0 or whatever figure you are required to put, sometimes we are asked to write narrative reports. And then in writing narrative reports, you need to write it following certain principles. And the principles are: one, you should have a clarity of your report. Your report should be clear, not ambiguous, very straight to the point, concise, be specific, be accurate, be objective, be coherent with your logical flow. Structure the thing the way it is supposed to be written. Your manager calls out one report on your promotion. You should ask him, how do you want it? What do you want in that report? What do you expect me to put in that report? Then you organize it logically. You must have a way of writing that it will attract the reader and retain the reader to continue reading your work. You can use visual aid to support your work. And I said that when you have a graph that demonstrates mortality rate, then we have perinatal mortality rate. If I want to know the month that had the highest perinatal mortality rate, I will spend 0.01 microsecond just looking at the longest graph and knowing that it was June. But if you do only narrative, I will spend about 10 minutes reading through all just to find out which month had the highest perinatal mortality. So charts and graphs and tables are important. Now, how do we write this report? First of all, you have to understand the purpose of the report. Why are they asking you for that report? And what are they going to use that report for? You have to ask your manager. The report you are asking me for, sorry, what is it for? What will you need? What information do you require so that I can be able to gather those information? So when you know the purpose of the report, you can know what information to put together. Then based on that, you ask, how do you want it? Do you want it as abstract introduction, body, conclusion, or you want it nyama basha? then you structure the work. So you must learn to structure your work in a logical flow. Because if the work is bizarre, nobody will enjoy reading it. But if it's a logical flow, it flows systematically, then you will understand better that what this is a good writing. Then write a draft. I always tell people that writing is a skill. Your ability to write very well for people to read and love it is a skill. And if you don't develop this habit of reading, you can't develop the habit of writing. Because you have to read literature to enhance your vocabulary skills so that you can speak and write well. And even know that there is a difference between writing American English and a British English instead of mixing them up. Because sometimes we don't know where to use the S and where to use the Z. We mix them up anyhow. And it's not a good writing skill. So I tell people that before you submit your narrative report, write it 3 to 4 times. Write the first one. Then sleep and wake up in the quiet hours of the night and read it. You realize that it will be made up of some little or so much of chaff. You get rid of them and rewrite a new one again. Now you read it again. You realize that you have forgotten some important thing. You add it. Then you read it again. You have to read your work over and over. Be sure that you cross the T and comma the commas. Sometimes those of us who even have friends who are very good in some of this proofreading and editing, you need to let them read it. The English is not our mother tongue. We have borrowed it. So there is nothing wrong with asking a friend to put a second eye on your grammatical compositions, your sentence completeness, your accuracy in your punctuations. There is nothing wrong. But at the end of the day, when the report goes out, it is a signature of your intellectual capabilities. If you miss it, you have missed everything. So that is very important. So you have to always write, not at once. But you see, we are so lazy that we wait 2 hours to submission, then we'll ask ChatGPT to generate the report. Now, ChatGPT is garbage in, garbage out. It will generate something for you. It's IT. It will definitely generate. But as to whether that is factual and correct, you wouldn't know. And I tell people that, unfortunately, I find people using ChatGPT to generate proposals and research. ChatGPT was never meant for research. It's a social construct AI tool. And most of the times, it generates literature that do not even exist. And the construct sometimes it brings can be correct, can be wrong. So if you yourself don't even know the writing, how will ChatGPT to help you? The AI tools are only there to help us, but not to replace our brains. They're only there to enlighten us, but not to bring. You see, when you use AI to do something, you submit it, and it's detected as AI. What it means that you are just carrying a drum, empty drum, a danderhead one. Because even if you use AI to generate the thing, you must have read through to correct some few errors. Some of us AI will bold the thing, which will copy and paste, bold it. Even asterisk is inside the middle of a sentence. You go and see a sentence that doesn't deserve a comma is lying there. Because you have not read it, you have given superiority to an AI instrument than your own brain of intellectual capabilities, which can advance better and comprehend the situation at hand. You have done the work. You have performed your activity. You know your things better. So an engine that didn't participate in your activity to generate that report for you, then you review and write and submit. You must have confidentiality in the report you are writing, because there are law protections to data handling. Those of us who are collecting research data, you remember that whatever data you're collecting from the client, it's your responsibility to protect, so that the identity of that person is not revealed in alongside with the data or the findings you are going to produce. You must adhere to high levels of honesty and integrity in your report writing. If you are writing that you yourself do not have honesty and integrity, whoever who reads it and discovers that this is untruthful of an event, in that will conclude that the writer is also an untruthful person. You must be professional and maintain respectful and objective tone. Some of us, because we don't read, we don't even have better vocabularies to write. So you find the Peruvian way of writing things. This is this. Somebody repeatedly use one word. When there are other better, synonyms and what you use to enhance your reading, your writer for the reader to enjoy your reading. You see, you must be timely. As for Ghana service that we know, they say by 5th of every month you should submit all your report complete and what? Accurate. Mistakes we make in report writing. One is poor organization and lack of structure. Sometimes because we ourselves will not read around, we don't even know how certain reports look like. How many of us has ever visited our health directories to pick their annual reports to read and see what has happened in my district as far as 2025 was concerned? This was how they structured their reports, how it looked like. We don't read, so we don't know. Informal and vulgar languages, inappropriate use of certain terminologies. Some terms and words are acceptable in some domains, but when you are writing reports for another domain, they are unacceptable. You must know where to use what term. You must be formal in your reporting. Omitting important details, dates, names, references, citations. You state a fact and you have not told us where you got that fact from. Definitely that fact didn't come from your head. The only facts we don't state with references are common knowledge. A common knowledge, a practical example is exclusive breastfeeding for 6 months. It's common knowledge. So if you tell me that you have to do exclusive breastfeeding for 6 months without giving me a reference or a citation, that one is common knowledge. But you can't tell me that 80% of women in this community have died from HIV. That is not common knowledge. You have to tell me where you got that data from. You have to let me know where you had that information from. Grammatical and typographical errors, because we will not take our time to write and read. Last minute, you are in a hurry, then you are in a hurry to get to the full stop and submit the work. Failure to follow institutional support, guidelines, and what? Instructions. Yesterday, I was telling one of the classes that in Ghana Health Service now, that is the principle. If you are not ready to obey instructions and respect authority, you will remain at where you are. You have nothing to go, nowhere to go. Because even in life, in academia, in research, people are looking for people who are ready to follow instructions and obey rules and regulations. Nobody wants to associate or work with somebody who, when he say A, he'll tell you that it is C. If you know it is C, why did you come to me to be mentored? Failure to follow instruction is very important because it will not lead you to the road, to the end of the tunnel where there is light. The person leading you there will leave you behind because you are not following his directives and instructions. And that is what most of the time happens between sometimes students and lecturers and then supervisors and employees, because they give direct instruction and you feel that that person is not capable of, is not supposed to give that instruction. So you do what you want to do. He should do whatever he wants to do. Definitely, you also do whatever you want to do. And at the end of the day, who is going to suffer it? Most of the times, we the subordinates, we suffer it. At this point in time, we will call it a day. And I'll leave you with a key message that as we go about our normal activities, today let's learn how to read and read and read so that we can enhance our communication, the use of better vocabularies, use of better skills, use of better adjectives that will enhance our communication with ourselves, our peers, our leaders, and our subordinates, and also enable ourselves to become people that will what? Be what? Obeyers of what? Rules and regulations in our settings. Thank you for your time. And if you have any question, any contribution, any subtraction, addition, multiplication you want to do, please, you can just do that within the next 15 minutes, and then we can call it a day. Anybody with a question? So it's contribution time. If anybody have anything you want to contribute about, you want to suggest, you want to ask question, you can do that now. And then We'll try to demystify if there is the need for. If there is none to, as you're all quiet, I believe that there was better communication and better decoding of the message. So as I communicated and I sent my message, there is a better decoding. So I thank you for your time and I appreciate your earlier on participations and submissions. They were all laudable and very, very accurate and on point. And those are some of the things that make lectures and classes interactive. When students participate and share constructs of their own, it also shapes us to also know that when we are coming, we are also supposed to prepare and come, because you also prepare before you come. I thank you all for your time, and I pray that we meet next week in good health, sound mind, and well prepared. Thank you, and enjoy your week. Bye.
Thank you, sir.
Bye, sir.
Bye, sir.
Bye, sir. Let's go. Let's sleep on the floor. Go get down. No. Don't let my phone fall down for me. I will chew your neck. Yeah, to chew my neck now. And I don't have to Mom, see. Mom, that birthday. Ah. Yeah? Yes, honey. Baby, when
Queen, unmute you.
what is going on there? Yeah, that is still doing it. Going to your to play again. Sit on you. Get down. Where are you going?
Peace, Ahazi, we've closed. Peace, Ahazi, we've closed. Please leave the platform.
Go. How are you? In the water. What is it, sir? Give me the key. Give it to me. Give me a nice to There's a bicycle is something.
What's the bicycle for the email? Email for email.